Hello, everyone. Welcome to a brand new episode of One Vision, the FinTech Views. This is Theo, your host for the episode. Now, I wanted to go back to the roots of the podcast. For those of you who have been with us for the last 5.5 years, thank you so much for sticking with us. And you would record the first season we ran were about longevity and FinTech, caregiving, and using technology for good to take care of people that we don't typically think about in the venture world was very much and still is very much the heart and soul of what I would love to do and what I admire the most. So today for our episode, we are bringing Nima Roohi Sefidmazgi, CEO and co-founder at Blooming Health. Welcome to the show, Nima.
Hi, Theo. Really appreciate you having me on. Hi, everyone. Excited to talk to you a little bit about my journey as a co-founder and entrepreneur in the healthcare and social care space. Excited to dive in.
This is a very important topic, I believe, not just for health tech founders and people in the space, but practically for all of us, because we do all get older and we do all have parents, we have loved ones that we need to take care of, and it's a very challenging space to navigate. So I admire you for what you do. That's just, I just
I
want to say
appreciate it.
that out loud. But before we get there, you have a very fascinating background. I think you're the second guest in the show in the last month that we have someone with. It's something that we don't typically see in fintech nor health tech world. And your background is studying computational mechanics
Yeah.
and previously working as a data scientist. I love numbers. I love data. So this is like, I'm just like fangirling at this point. Now, I wanted to ask you because 4.5 years ago, you decided that you wanted to start a entrepreneur journey
Yeah.
and with Blooming Health to build, I believe you mentioned, a single touch point for all social service needs. Can you walk us through that aha moment? Because that's very different than what you were doing before and
Yeah.
what drives your personal passion for the vision that you have for the
For
company.
sure. Absolutely. Yeah. I appreciate the thoughtful question. So, uh, maybe a little bit of a kind of a background about me would help to kind of answer that and kind of give a little bit more color on why I got excited about starting and building Blooming Health. So, as you mentioned, I actually come from a background in science and engineering. I'm a first generation immigrant, came to this country around 2010, went to the University of Wisconsin-Madison, did my master's and PhD there. As always, a computer geek, even though my kind of major wasn't computer. I actually built a lot of software solutions throughout the process of getting my kind of grad school degree, doing my thesis on kind of construction materials, but also kind of with computer vision angle to it. Um, I got really excited about the application of technology in real world and specifically kind of automation and machine learning technologies, and decided to kind of build my career around that. After Madison, I came to New York City, started working in the original field that I came from, which is like materials science and construction and building technology solutions in that space. Couple of years in, had a few kind of pivotal moments in my life. One of them was one of my loved ones to be diagnosed with stage 4 cancer, and making me and my family kind of first degree caregiver to that loved one. And again, as a reminder, first generation immigrant probably never has a very significant healthcare event and kind of struggling to navigate healthcare until it happens for a loved one or for them. And unfortunately, that first kind of interaction typically is very surprising and challenging because with fresh pairs of eyes, you see a lot of gaps and challenges in the ecosystem. It just happened that this problem happened to us around when COVID happened in New York, and we're living in New York City, and the city was under lockdown. More importantly, our friends were disconnected from us, and we had to provide care on our own. We had to literally figure out how do we get a specialist to give us an appointment? Do we need to go to ER to get that appointment, or do we need to find a primary care physician? And then during COVID, primary care physicians had this kind of confusing process of you can't go to their clinic, you need to do testing before you go in, and all those sort of things. So all that complexity kind of was pretty overwhelming. I thought that a lot of families are going through this, and especially around the problems you need to solve outside medical facilities, the care you need to provide that is non-medical. Actually, the medical care is probably the easiest part. When you need to make sure every time your loved one needs to go to the clinic, they have a right to go in, or you need to give them a right, no matter what time of the day it is. You need to make sure they have a proper meal to eat based on their health condition. You need to make sure their healthcare services are covered by proper insurance. So you're not getting surprised with healthcare bills and so on and so forth. Understanding all of that made me more conscious about this broader ecosystem of care, which is kind of happening outside medical facilities, called social care, which is what kind of inspired me to think about solving some of those problems. At the time, I was running a global data science team at Bayer Pharma, and there I was building actually technology products for healthcare operations. We were partnering with Optum, arm of United Health Group. We would buy electronic medical records data, and our team was in charge of building machine learning solutions on top of that data as risk prediction tools in the clinical setting. And even there, I was seeing that the electronic medical records we're using for algorithm training is missing a lot of other types of context, like social needs context. I know what the person's blood pressure was the last time they came to the doctor's visit. I know their basically lab results. I know all the diagnostics measures, but I don't even know whether they have a food to put on their table or not, whether they have a roof above their head or not. And like all those things contributing to their healthcare outcomes and their life situation. That's when I actually joined forces with my two co-founders. Were like just happened that we were a part of a New York City meetup called AI in Healthcare. And the way we got started here was we were running a hackathon in Brooklyn, New York, a day hackathon for some developers. We were just kind of quote unquote industry supports for the people that were developing a solution. If you're familiar with hackathons, a day event, a bunch of developers coming together, trying to spinning some POC solutions together, competing for some prizes, but also kind of figuring out potentially some kernels of ideas that they could execute on. On the side of that, we grabbed beer, and it turns out my two co-founders, Naman and Kavita, had very similar life stories, providing care to their loved ones, first-generation immigrants, working in this space, healthcare and technology, and being excited about the social determinants of health, the social care ecosystem. That's how the whole story started, and we actually we all three of us had day jobs at the time. We didn't go full on building the company. We actually spent 6 months to a year spending time in the communities. Like we literally would take some time off from our day job, buy bags of fruits and snacks, and go to the community-based organizations like neighborhood senior centers. Obviously, we would coordinate in advance, sit down with seniors for half a day, kind of eating on the snacks and talking about how they get their life running on a daily basis. How do they get their prescription refills? How do they connect with their loved ones? Can they FaceTime their family? How do they get their healthcare appointments? How do they manage their finances, their tax kind of payments on an annual basis, etc. Understanding that a lot of these interactions, especially for underserved populations like older adults, the technology solutions are overlooking potential kind of barriers for adoption. And that kind of created a lot of idea for us. But the most important one that we learned there was like, there's this broken bridge in the communities, the broken link basically in the communities where when you're an older adult, when you're a disabled individual, a Medicaid patient, people that are typically either underserved or facing some barriers to services and care, you have a disadvantage by definition to receive the care you need. You have a disadvantage by definition not benefiting from the Ubers of the world, the Amazons of the world, to get you the best services you need. You cannot hop on an Uber to go to your next appointment setup. Um, you cannot shop online because you might not have access to technology, you might not have enough technology literacy, etc. And then this is like pre open AI kind of wave of new AI world. But we knew there's some, like working in the machine learning space, we knew there's some kernels of ideas here that automation could make access to some of these services a lot more equitable. You no longer need to be able to navigate a cell phone app to be able to get access to care. You could talk to something and you still could get the care you needed. You don't need to speak English to do it. You could basically do that in your native language. And that's when COVID hit New York. The city went under lockdown. A lot of organizations scrambling around to figure out how to connect with people, especially older adults, because they didn't have a lot of digital footprint, and they were literally at the highest risk because they couldn't go grocery shopping, picking up prescriptions, they couldn't go to their doctor appointments. And we basically spun up our first idea of an engagement solution based on AI that can call these people, text these people, at the time just talk two languages, English and Spanish, and be able to do wellness check-ins, get them connected to resources they needed. We launched it in East Harlem, New York City. Again, like this is late 2020. And then based on that, we started basically seeing a lot of traction and market pull, which convinced us to give up our day job and then go full on the entrepreneurship journey and building the company.
So many things I wanted to say. It feels like our paths actually run in parallel and echo in some ways. I'm also first generation immigrant, so I absolutely understand what you were talking about. I lived in New York and then I moved to Wisconsin, and then I moved back to the East Coast. It was way too cold for me. But there's something about what you said, the conviction that you have, being able to identify and understand and be aware that there is a massive gap that you can actually do something about it. I often say those who give up their day job and to become startup founders, they are the gutsiest, most courageous humans you can ever find, because it's scary, especially during COVID. I mean, there was so much uncertainty, and yet you went ahead. That is absolutely admirable. So that's amazing. And then fast forward to, you recently announced a 26 million Series A.
Yep.
Um, I wanted to ask you how you feel, but that's kind of a silly question. Beyond that, I know when we met first time face to face, it was Blooming Day, which was it the second year, right, that you guys
Yes,
are
it
hosting
was the
it?
second year. Yes.
Okay, and in there you mentioned, you gave an amazing speech on stage, and then listened to it, and you said you talked about scaling, you talked about using technology and bringing it in to scale operations to more people, 10 million people to be exact. Wanted to ask you, um, where how do you think this funding will work to what you're trying to do? You talked about, now we are in a perfect time, if you will, looking at using agents and other technology to help you automate some parts of the engagements that you've been doing, the wellness check-in. Um, what might we see in the coming months from you guys?
Yeah, for sure. Uh, so obviously, it's exciting to have the privilege to build this company and then be able to prove that there's both a opportunity to do good for the communities and an opportunity to build a sizable business out of it, doing good for the communities. I think there's a couple of different things to take into consideration here. One is like I think like there's this whole kind of federal policy impact on the healthcare and government and local governments, and then how do you deliver healthcare and social care to the population in scope to consider when we're thinking about what products we're building and what type of solutions we're bringing to the market. There's a lot of conversation around efficiency. There's a lot of conversations around how do we reduce the cost of healthcare in this country. One of the real kind of convictions I have, and the inspirations we have, is that the healthcare cost in this country is very, very high. That is a famous thing, not new. Like, we're 18 to 20% of our GDP is going into healthcare. Um, for sure, there is efficiency gains to be developed in this ecosystem. Obviously, how the policy impacts is different, but I think there's cases to be made on how technology can play a role here and impact it, and that's really the role we are trying to play here. I think one of the most important things we're trying to do here is to prove with scalable and accessible technology that investing dollars in social care is in fact saving dollars on overall healthcare. The equation is very simple. It's very intuitive. If you have a diabetic patient, let's say an older adult that is diabetic, let's say that older adult is a grandma that has movement impairment, cannot cook any longer easily in the kitchen. So they end up eating really bad food because they can't cook all the time. They might eat um, fast foods and stuff like that, which ends up putting their diabetes in a worse situation, ending up in ERs, and then ending up costing a lot of dollars and a lot of quality of life and independence for that grandma. Now, in a parallel world, think about a system that can get that grandma a meal they need every time they need that meal, with fresh produces, with quality nutrition that prevents them from ending up in ER, right? The difference between the two, in our view, is the difference between the infrastructure that is trying to solve for this problem. The reason you cannot get that care today in a timely manner is not because there's no will to do it. I don't think there's because the policy and payment infrastructures are not there to do it. It's because you don't know who, when, and how to deliver that. That needs continuous engagement with the population you're serving, detecting their needs in a timely manner, and then dispatching services to them in a timely manner to be able to address their needs. The difference between what is possible now with AI and what wasn't possible before this is basically that you can now do this at scale. A health system that serves 1 million people can stay engaged with those 1 million people every week. It doesn't need to be episodic based on when they show up to the clinics. You could detect those needs, you could stay engaged with them, you could address their needs. That's where our product roadmap is going. In general, our product has a few different components that is leveraging some of the technology that exists, and also some of our know-how of the workflows needed to deliver the services. The first one is really kind of the conversational AI. The inlet for the population to address their need is to have a conversation with them. It's basically to be able to have a conversation with them in their channel of comfort, in their language of comfort, in their time of comfort. That's how you can collect quality data from the population in a trusted manner. After you can collect the data and you can engage them, then you can use that data to figure out what's the best intervention that can address some of their needs. Our product is focused on that engagement component first, then workflow automation on the top of that. So every caregiving experience provided by social workers, community health workers, care managers is a lengthy process. You start from educating a patient or a member about what services might be available to them, screening them for eligibility, finding a resource they might need, physical resource they might need, and that can address their need. Like, it needs to be close to their zip code. It needs to be able to address their need. It needs to kind of have a payment vehicle in place to pay that organization for the service they're providing. After that service is delivered, now following up with a member or patient to make sure the care they got was appropriate, addressed their need, reduced their risk profile, etc. That process of care management typically happens over weeks and in hours of work by care manager. Now, in the world of AI and automation, what we're trying to do is basically to do that in seconds or minutes. The care manager could set up this workflow on our platform, could kick it off to the population, millions of people, and you can just monitor the process and see how the needs of that population gets detected, addressed, and then intervene when there's a complex scenario. where a human navigation is needed, where kind of automation is not enough because the problem is a kind of multidisciplinary problem. There's a lot of emotional angles to it that the care manager needs to be involved with, and there's more sensitivity around the need that a human needs to intervene and address. But there's an 80-20 rule, and that's what we're leveraging on our platform. We're investing on that. We're investing on building our automation capabilities further. We're investing on building our integration capabilities further. The whole ecosystem, the key word in the whole ecosystem to create impact is interoperability. If you're building AI in the healthcare, you need to be interoperable. You need to be able to integrate with electronic medical records. You need to be able to integrate with patient management solutions, CRM tools, etc., to be able to really automate work. Else you're just automating a piece of work and creating another piece of work for the staff members. That's where we're investing most of our kind of time and resources. And we think going deep there is going to help the communities and the organizations we're working with, basically.
It's delivering care to when they need it, how they need it, and where they need it, and automated by technology.
That's exactly right.
That
That's
seems
independent of where you live, what language you speak, whether you have a broadband or not, whether you live in downtown Manhattan or rural Arizona, um, all of that taken into account, because that's how you could actually manage risk in the population. I know these days there's this whole confusion and sensitivity around using the keyword equity. Equity has a mathematical definition to me. Equity is basically, can you capture the risk across the population and manage that risk by addressing the needs of the whole population, not just certain kind of stratified segments of population. That's how you could create sustainable outcomes in cost savings in healthcare.
equity is one of my favorite words too. It's in the
Absolutely.
first page of my new book. Um,
Absolutely.
it needs to be the center of everything that we do, because otherwise, um, why are we doing what we're doing, right? I remember hearing someone who told me recently, he said, if innovation does not make the world a better place, then what's the point? Um,
Absolutely.
and you guys are
100%.
doing 100% of what we can use technology for. It's fun to create action figures, but it's more meaningful and impactful when you can actually bridge people with the needs, with the support, and help keep them healthier, help them live more independently, and help them get access to what they need. I mean,
Absolutely.
that's fundamentally, that's what being a community is about. And
100%.
I do want to ask you though, because oftentimes when we talk about agents, we talk about AI, we talk about technology, it almost feels like we are taking a layer of the human touch and just kind of putting them aside and say we're just going to automate these pieces, we're putting these pipes in, and we're bringing these pieces together. How can we balance bringing efficiency to the system, bringing interoperability to the system, while preserving the human touch?
Yeah, that's a great question. We spent a lot, like I would say the last um, 4 or 5 years that we've been spending on this journey. This is the consistent theme we think about, and then this is the consistent question we think about. We started our kind of company by serving older adults first. Then we started expanding into the broader population, the Medicaid population, dual eligibles, veterans, early childhood programs, etc. But then starting from older adults, especially individuals with multiple chronic conditions, individuals with a lot of different types of needs, we learned that human touch matters significantly. If you talk to any individual that provides care and services to older adults, especially as they're like professional care managers, social workers, The consistent theme you will hear from them is every time they call an older adult for a check-in or for a follow-up on an intervention, service, appointment, etc., they end up talking to them for half an hour, 45 minutes. The primary reason being that older adult might be talking to that care manager as the only human being during that day. Um, and we know that the human touch matters, not just in the kind of utilitarian kind of process of providing care, but also in an emotional and mental health kind of angle, supporting that individual, feeling empathetic with their challenges, and kind of helping them feel the trust that this process is going to help them. That whole trust is a huge element and a byproduct of a proper human touch. So understanding the importance of it, what part of our mission always has been kind of, first of all, knowing that human touch is a limited resource. Understanding that you have so many care managers, they have so many hours in the day, and that's a limited resource you could utilize. Um, in an ideal world, if that was unlimited, you never need a technology. To be honest, the pragmatic and the challenging part is like that is not unlimited. So understanding that is really the art here is bringing in technology and data to figure out where that human touch is the most necessary as this very important yet limited resource you have to allocate and drive outcomes. So part of the work that AI enables us to do today is to be able to understand at the top of funnel of engagement with a population, what are some of the categories of needs and life situations where human intervention is needed, and then flag that for care managers, for social workers to engage with that individual in a one-on-one setting, in a conversation. That actually is an interesting byproduct of technology, but also an important aspect of it. So let's say pre kind of having these types of automations in the world, if you're a care manager and you're handed over 1,000 people that you need to manage care for, you need to interact with, do wellness check-ins on, etc., 1,000 people, you probably are going to end up engaging a fraction of them every month. You're not going to end up engaging all of them. The problem here, though, is that by definition, you don't know whether you're engaging the most important people, the people that has the highest burning needs, immediate needs today or not. So you're providing that human touch, but we don't know whether that human touch is being funneled to the right people in the right time. And as a result of that, you might actually have a lot of opportunity cost where you're interacting with another patient, all good, you're having a conversation with them, but that's just an interaction, whereas another patient that needs your attention, that is suffering from some challenges, might fall through the cracks because of, by definition, your bandwidth, you cannot interact with all of them. So the technology is enabling us to understand where those biggest needs are, and then funnel that limited resource in a continuous basis to the most needed area, which then can create the biggest outcomes. This is actually the kind of counterintuitive outcome of using AI to make compassion scale. Basically, this was, if you remember, the title of my talk at Blooming Day. Like, that's literally our thesis. In order to scale compassion, you first need to be able to scale where that compassion is needed, and be able to then direct the limited resource of compassion and empathy and care you have, the human side of the caregiving process, to those areas that the biggest need exists. So if you have a system now that can talk to 1 million people, can talk Arabic, Polish, Cantonese, Spanish, English, can talk any time of the day, any day of the week, can talk in any channel those people might have access to, you're not relying on a phone call from your care manager to that individual, maybe 3 times or 5 times sequential calls until they pick up. You're not relying on that. You're relying on a system that is going to engage with them ultimately, is going to detect their need, and then from there is going to help you basically direct your resources to those people that have the biggest need. This was actually, I had a few examples of this happening early on when we started during COVID pandemic. One of the things that people were just kind of stressed out about and trying to figure out was like, who are the older adults that might have caught the virus, that need some sort of early intervention before they need to be hospitalized, basically. And the problem is you cannot call every older adult in the city of New York, but you can, like, through your care management team, but you could engage with them through technology, figure out who might have certain symptoms that need some sort of engagement, then call them, figure out how you can help them, and so on and so forth.
Helps you prioritize where you need it the most.
Absolutely,
Um,
100%.
that seems like such a common sense, but yet it is so hard to do. You're scaling empathy, you're scaling human touch. In some ways, that sounds kind of funny, but makes sense. Um, taking
Can
this,
I, can I
yeah,
one more
yeah.
thing actually? This is super important because this is kind of a, there's a broader theme around this. Like,
Hmm.
as AI is taking off and becoming more powerful, a lot of people think about AI replacing human uh, being as a resource that is delivering the value in their jobs or delivering outcomes in their jobs. I actually have this kind of not so contrarian thesis, but a thesis that's like so important to grasp, that AI could actually make human intervention a lot more efficient and impactful. It could make human talent a lot more impactful and accentuated with orders of magnitude better outcome. If you are a doctor, a nurse, a care manager, your skill set doesn't need to be everywhere. It needs to be in a few places where you could drive the biggest outcomes. In order to know where, AI can help you, because there's a lot of other stuff that are mundane stuff to take care of that AI can take care of, and open up your bandwidth to funnel your talent and your experience where you could move the needle the most.
That is a really really important way of looking at it. You're absolutely right. I get so buried, especially in the last half year, where every time when someone's talking about deploying AI, especially in my world, is looking at how do we automate everything. And then my next question always is, what do we do with the humans? And what do we do
Yeah.
with, the analysts, the accountants? But you're looking at it in a different way. And I think that is actually a more important way, a more human way of thinking about it. See, that was, I'm just gonna say this out loud. Last time when I met you in New York, I told Paolo, I said, I felt like a therapy session just being there with you guys that one day, because it gave me a different sense, if that's even the right word for it. It gave me a different um, lens of thinking about deploying technology in the world when it's not always doom and gloom, but actually using it for something impactful. So for that, thank you. Um, Again, I'm
I
just going to keep
appreciate it.
saying this, but
I appreciate it.
if we take this forward, right? Continuing the helpful notes. See, what you didn't realize is that I'm doing this in disguise as my therapy sessions. Just keep interviewing people,
Understood.
but. Where do you see social care extending beyond where you see, your plan for the next 12 months? What role will this technology play in our world, and where do you think might be the biggest challenge in making your envision a reality?
Yeah, that's a great question. I mean, I think we have some, I'll say, thesis around what the potential directions this might take are. Obviously, we execute with that vision in mind, but the real world always give us a lot of interesting surprises along the way, as you know. Um, um, Here's how we think about social care. We think social care is actually kind of an underestimated um, investment and arm in our communities to not only reduce our healthcare costs, which is historically been like the most focused part that social care can actually create financial outcomes, it also is a part of our bigger economy and can enable a lot of communities that today are not necessarily contributing to their full capacity to the economy to actually be able to have that type of contribution into the broader economy. What that means is, like, we have a lot of communities in our country here where the community members are not able to work well, they're not able to kind of have access to high quality, high paying jobs because of some of their kind of social needs comorbidities they have, if we can call that. If you're food insecure, if you're housing insecure, if you cannot go to your healthcare appointments because you don't have a right to go to the healthcare appointment, if you can't pay for your utility bills, or you can't pay for food, that puts you in a disadvantage. So what I think that we're going to recognize is this. I think there's a kind of a first degree impact, which is technology is going to empower us to deliver a lot more efficient and better social care to the population, which in the first degree impact is going to show us some cost savings in healthcare. I can't say that like social care is the silver bullet to our whole kind of healthcare economy, but even if in this healthcare economy we reduce the cost by 1%, we are talking in tens of billions of dollars, towards hundreds of billions of dollars. So the impact could be huge there. The secondary effect, though, I think is going to be for local governments, for federal government, and even for healthcare stakeholders to recognize the work they're doing is actually contributing back into the economy, and then seeing the ROI in the lens of the broader kind of secondary impact it might have. From a technological standpoint, so this is kind of a, I would say, macroeconomy kind of impact that the social care might have. From a technological standpoint, our vision is to make social care accessible in every household like tap water. Like, if you are a household in need of any type of social care, you can talk to a system. It can be your phone, it can be your smart home devices, or it could be a landline. You dial a number. You can talk to a system and get the care you need. You don't go through hundreds of pages of documents. You don't go into 5 different appointments. You don't need to submit a lot of documents to get the care you need. You get the care you need. The same way you get a ride showing up to your door today when you make a click on Uber. The same way you get a meal delivered to you when you click on DoorDash. So that's really where we want to get social care to. In fact, this is very much aligned with a lot of our public health partners across the nation. They have the same vision. They want to reduce the friction to zero so that consumption of social care becomes as natural as consuming tap water, which then makes the impact it can create way, way bigger. We are at a point of kind of technological adoption curve that this is fully possible. AI is going to help us to basically extend our human resources in this ecosystem, in this industry, to a level that nobody gets left behind. That the vision of having access to social care in every household is really a reality. You don't need to wait until Monday morning to get a ride you need on Monday for your healthcare appointment. And then I think this will then encourage more of technology companies to come and play a role in it. Just imagine if we're talking about providing a ride, delivering a meal, providing housing. There's a few public companies that come to mind. Every one of those categories of needs we talk about. If we talk about a ride provided to someone from home to healthcare facility and back, we're thinking of Uber and Lyft, right? There are technology infrastructures out there. All we need to do is basically to build the infrastructures that can funnel that supply into the demand in the right place in the right time with the right payment infrastructure that can basically facilitate the sustainable delivery of those services. So these other technology stakeholders become a part of that ecosystem. And that makes it even more scalable, so that if my mom needs to go to a healthcare facility, um, and getting a treatment, I don't need to take off for half a day of my work. She could talk to a system, get a ride, go and come back, and that feels like a very normal course of action. Basically, it doesn't feel guilty for me, it doesn't feel frictionful for my mom, and it doesn't feel hell of a kind of a costly process for the payer in this scenario, health plan or a local government. That's really kind of the future we're envisioning, um, around social care, which I actually think that if we can accomplish that, it's gonna it's gonna have a lot of interesting impacts on the politics level as well. I actually think that the polarization we see in the politics today could be reduced if we have better social care infrastructures in the communities, if we address some of the basic needs of our population. Their kind of differences become a lot less prone, a lot more productive to create better social outcomes in the communities.
I do agree because recently I came across a map that shows the lifespan of population right around the country, and you
Yeah,
can see the hotspots where people tend to have more health challenges and shorter uh, longevity, if you will, for lack of a better word, in certain areas of the country, in certain states. And a lot
yeah,
of that is tied to the state policies, tied to the access or lack thereof to care, to healthy food, to, everything else, right? That we know what those items are. And so if there are ways that we can bridge that difference, and as you say, bring social care to everyone and make it accessible to everybody, that's a way to reduce that friction point and to hopefully create more cohesion between communities in the country. Um,
100%.
there's
That's the
hope.
vision.
There is
Yeah,
hope. Before I let you go, because I know I can probably keep this going forever, but before I let you go, there's one last thing I want to ask you.
sure.
If you were to have the superpower to change one thing in the world with AI, there are lots I want to do, but if there's only one thing you can do, um, what would that be and why?
Yeah, that's
You're
a
gonna
really
say
good question.
blooming health, make it available everywhere and solve all social
Yeah,
care issues.
obviously that angle matters to me a lot. That's why I'm kind of putting my life's work in that. Um, very obviously, kind of deploying AI for for access to kind of some basic services, some basic social care the populations might have is of interest to me. I actually think, I mean, here's the way I think about AI and like where I see the biggest value of deploying it. I actually think that if you think about kind of the course of human history and the technology evolvement and evolution over time, I think we started with being very humanly connected to each other as a species, as a communities, addressing the needs of the communities in a very small kind of closed settings, um, and spending a lot more time with our families and with our friends. Over time, we became this industrialized society, which we kind of spent a lot more time in our professional life. It's in servicing other people's needs and earning the kind of the outcome of it to be able to address some of our own needs through the services provided or products provided by others. I think the future is going to kind of have this cycle going back to where we started, and I mean that in a good way. Meaning, like, I think AI is going to do a lot of this stuff that we used to not do, and they became this kind of somewhat boring but kind of must be done part of our societies to be sustainable. Um, I think that the future is going to be more of us spending time with our loved ones and not needing to kind of be worried about all these paperworks, all these institutions, infrastructures that we need to navigate to address some of our day-to-day needs. And that is why, like, this whole application of AI in social care and what we're doing at Blooming kind of matters so much to us. I feel like it makes our communities more humane, and get us to spend more time with each other. We actually started early on building Blooming Health, the very, very first version of our product. Our kind of mission was addressing social isolation and loneliness. It's like that was what we're trying to solve for. And we knew that social isolation and loneliness has a lot of negative health impacts, especially amongst older adults, especially in the industrialized world where, like, your family members leave you because they need to work in other cities and states and countries, and then, like, you age and you live longer because of the food and healthcare technologies that we have right now. But you end up living alone at some point in your life. You lose your friends, and that loneliness kind of compounds your um, bad health conditions, bad qualities of lives, and then ends up being a really, really big problem across the board for quality of life, for cost of care, etc. When we started addressing social isolation and loneliness for older adults first, and then the broader population, it turns out that social isolation and loneliness is a function of a broader types of needs that the person might have. An individual that might be concerned about their health, about their having a food on their table, about paying for their bills, you're going to have a harder time convincing that individual to go and hang out with their friends. You're going to have a lot more problem convincing that individual to spend dollars and go spend time with their family. If you can address the needs of that individual, the basic needs, you have a higher probability of social engagement, social connection. So that is why uh, our mission converted from solving for social isolation and loneliness to solve for social care access. So as a downstream of it, we can live more humanly. We can actually connect with each other better. We can spend more time with our loved ones. The older adult that is living in our community doesn't need to end up in a long-term care facility. They can actually live in their community, still can hang out with their friends in the neighborhood park or neighborhood senior center, etc. And that's how they don't feel lonely. They have actually a reason to live. They feel kind of a cause or mission for their life. So that's really the ultimate goal here. And I feel like if I were to pick up one place, that's, let's use technology to address some of the basic needs of the population so that the time they have on this in this world is actually well spent with their families and loved ones and a higher quality of life than spending processing paperwork or navigating a whole institution to address a very basic need they might
Back to what matters and where it matters, and bringing us back to community. You basically summed up why we started the podcast, was to bring the community of people together, um, to feel humans again. And yes, absolutely, kudos to that. I can't wait to see the next version of Blooming Health and where you guys will start
have. Absolutely. I
creating
really
more
appreciate it.
impact next. So thank you so much, Nima,
For
for
sure.
spending time with us on the show. And for the rest of our listeners, thank you so much for joining us for another episode of One Vision. We'll talk to you next week.